Should I get breast augmentation or not? Still can't decide? I've been doing breast augmentation surgeries for 10 years? How many years? Or was it 17?
It's been a really long time.
So yes, as a breast surgery expert, today I'm going to share some tips with you. I'm the head doctor at Human Plastic Surgery Clinic. My name is Kim Kook-hyun.
I'll ask some questions. Please answer go or stop.
Should I get breast implants just for my boyfriend?
Stop. Actually, I think this goes for all types of plastic surgery, not just breast augmentation. Sure, surgery can improve your appearance, but ultimately, it should be about boosting your confidence, self-esteem, and personal satisfaction. So if you're doing it based on someone else's standards or expectations, it's unlikely to lead to a good result in the long run. So the best thing is to get surgery when you want it and on the area you want to improve.
Should I get breast augmentation after gaining weight?
Stop. Well, what really matters is the trend of your weight changes. If your weight is still changing, whether you're gaining or losing, then the situation is basically the same. In that case, it's better to wait and think it over, and only consider surgery once your weight has stabilized. If you gain a lot of weight, your breasts might get bigger too. So even if you're happy with the result right after surgery, if you lose weight later, your breasts might shrink again. Or in some cases, if you had large implants, they could start to show through the skin. Getting surgery after your weight has stabilized can help the results last longer and lead to greater satisfaction overall.
It's been 10 years since my surgery. Do I have to replace my implants?
Stop. The idea that implants placed 10 years ago must be replaced now, or that implants should be replaced every 10 to 15 years is actually more of an old school way of thinking. You don't still believe all of that, right? Even if you had older types of implants, what really matters is the current condition. If you don't feel any discomfort, and imaging tests like ultrasound or others show that your implants are safe, there's absolutely no need to get another surgery. If the implant is in good condition, then you can definitely keep it as is.
I want to go braless. Should I get breast augmentation?
Go. There are many reasons why someone might want to go braless. For example, some people say they just don't want to wear push-up bras anymore. Some people actually say they want to stop wearing braziers. They feel too tight and uncomfortable, and they just want to be free. If you want to improve the shape and firmness of your breast for that reason, then yes, breast augmentation with implants can definitely help a lot. However, how much your breasts will actually get bigger, and whether you should continue wearing a bra after surgery or not, that really depends on each patient and the size of the implants. So it's best to consult with a plastic surgeon and make your decision together.
Getting breast implants just because my friend did?
Stop. Honestly, this applies to both go and stop. If your friend had breast augmentation and it turned out beautifully, if her confidence grew, she felt more satisfied and her whole expression became brighter. If you're thinking, I want to get breast surgery to feel as good as my friend does, then I'd say go for it. But if you're trying to follow everything your friend did, the same implants, the same size, the same surgery, and just adjust it a little to fit your body, then I don't think you'll get the same result or the same level of satisfaction. The best way to find what truly works for you is to consult with a board-certified plastic surgeon and choose the right implant, size, and surgical method that fits your body.
Should I get breast surgery just because there's a limited time discount?
Stop. If there's a short-term promotion or discount event, I don't really recommend rushing into surgery because of it. That's because plastic surgeons perform breast augmentation with long-term results and stability in mind, not for a quick decision based on a temporary offer. So since this is a procedure meant to bring lasting satisfaction, it's important to take your time and think it through thoroughly.
Want to go bigger than my current implants, should I?
Go. Sometimes patients come in saying they're already satisfied with the feel and size of their previous implants, but they still want to go a little bigger. But honestly, if you're only increasing the implant size by about 25 to 30 cc, that's not a size change we usually recommend. However, if your breast skin has stretched over time, and there's now some extra space, then increasing the implant size by about 50 to 100 cc is possible. And if that size feels satisfying to you, then going a bit bigger can definitely be a good option.
Should I wait until after having kids to get breast surgery if I'm not married?
Stop. These days, even at our clinic, around 70 to 80% of patients are unmarried. Breast surgery, like any cosmetic surgery, is something you do to feel more beautiful and more confident during your best years. So rather than focusing on whether you're married or planning to have children later, it's best to get the surgery that you want at the time you want it. That's when you'll get the most satisfying results. Even though I specialize in breast surgery, when I get asked these kinds of questions, I find myself saying stop more often than go. That's because this isn't a surgery just for tomorrow or next month. It's something you do with the future in mind. So naturally, I tend to answer more conservatively and safely. I hope all of you make your decision about surgery very carefully and thoughtfully. And if you have any questions at all, feel free to leave a comment anytime. We'll make sure to get back to you. This has been the board-certified plastic surgeon at Human Plastic Surgery, Dr. Kim Kook Hyun. Thank you.